Still searching for cheap gas prices? Dump the pump and ride DART. You can DART to your destination for only $4 all day. Let DART do the driving while you enjoy our free Wi-Fi available on all buses statewide. While scrolling through your favorite apps, don't forget to download DART's free transit app for real-time bus information and enjoy the convenience of contactless fare payment through DART Pass. So what are you waiting for? Dump the pump and try transit. Visit dartfirststate.com or call 1-800-652-DART.
Good morning, Wilmington. What's going on? I'm Big I. We're talking to sound Mr. DETVCH.com. And this is a special Good Morning Wilmington interview. I have two beautiful women here, two beautiful doctors here, people that really care about the community here on the plaza. First off, I have Dr. Velma Scantlebury and Dr. Joan Coker, founders of the Delaware Health Equity Coalition. Ladies, thank you for joining me today.
Thank you for having us.
All right. Okay. Let's just hop right on to it. We all know who you are. And let me say thank you for what you did for us. And when I mean us, I mean our community during COVID. Really, really appreciate what you and your crew.
Right.
Absolutely.
I don't want to get your crew.
We had a crew.
You had a crew. And you were definitely capeless superheroes during that time and still today. So thank you so much. Okay. What we have going on.
So it's interesting that you would start with that thanks, because that's exactly where this vision has come from.
Okay.
Because what it was, while folks were, after they'd been vaccinated, you sit for about 15 minutes.
Right.
And when you just sit and talk with them and do more listening than talking, you realize that everybody just needed a primary care doctor that would listen. And it sounds simple, but that's it. I mean, they come in, they go out, they're gone in 5 minutes. I don't even know if they touch me. I don't know if they ask me about my medications, and that's it. So It was all of that. And for us, we've all been in medicine well over 20, 25 years.
Yes.
And when you hear something like that, you don't just sit on it, you do something about it.
Right.
And we're capable of doing that. And that's what we're going to do.
So we're talking about the caring aspect of and not just the bedside manner, but the caring. Or is that considered bedside manner?
Well, it's sort of both. It's really about listening to the patient.
Okay.
It's about hearing their needs. And one of the things that, the COVID pandemic did was it sort of unmasked the disparities. And you know that. And all of a sudden now we're talking about the inequities, the gap in healthcare that existed. And we know why there are disparities, because there are barriers, and those barriers that we now label social determinants of health. It's really about finding out why our community don't have access. And why are they not seeking access? It may be that if you look at 19801, they have a vast amount of resources there, but yet still the numbers and the disparities in outcomes are worse.
Why is that? Because I'm seeing, look, let's talk about it.
That's it.
All right, because I'm just like you both, and many other doctors, Black doctors, brown doctors, doctors of color, are asking that same question. We live in the richest country in the world.
Yes.
And why do Sussex and Middletown and Kent are suffering when people know that there is a problem?
Right. And it's really simple.
And we're talking about education, we're talking about health,
everything.
We're talking about everything.
Everything. But it has to matter to you.
Okay.
The people have to matter to you. So we can check boxes all day and talk about diversity, equity, and inclusion, but equity is the critical part of that.
Right.
So if you don't see those people as necessary or colleagues, cohort, whatever,
friends, family,
constituents,
other than voters,
then you're not going to render them the health care that they need.
Right.
And once they get there, you've got to treat them well.
Yeah, and that was one of the things we heard in COVID vaccination. Patients felt disrespected.
Did they really?
Yes. They felt that physicians didn't have the time to really hear them or even begin to understand their needs. Patients aren't not just compliant. You have non-compliant. What does non-compliant means? You didn't show up.
Right.
Did you take the time to find out why they didn't show up? Maybe they had transportation issues.
Right.
Maybe they had childcare issues. So it's really about listening to the patients, meeting their needs, figuring out what the barriers are to healthcare and wellness.
Right.
Being proximal to the patient and their vicinity, and being able to say, how can we eliminate those barriers? How can we identify what are your barriers to wellness?
Right.
What are your barriers to better health? How can we get you there? Identify those barriers, and then begin to work with the patient to begin to eliminate those barriers.
I didn't know that. I knew that inequity was everywhere, but I didn't know it was in healthcare to the level of what I know now. Yeah. We did a couple shows before with black mothers, and didn't know black maternal health was an issue.
Big deal.
Yes.
Never knew that. Blew my mind.
Yes.
Big deal.
And I see, and then just seeing it now, and like you said, COVID blew the whistle.
Oh.
Yes.
And it made people open up their eyes, right? Because now we're all on a playing field. We all we all meet in the middle of the field, and we all like, hey, this is the problem. And I didn't know that. And so you two ladies came up with a solution. What is that solution?
The solution is we're going to open up a primary care practice here in Wilmington, right in 19802. But certainly we'll take care of you no matter what your zip code. And our goal is to be up and down the state. And you don't have to explain to us that you had a decision to make between your hypertension medication and bacon and keeping the lights on.
Right.
Because we get it.
Right.
So what we're going to do is we're going to work to help you navigate these crazy waters that we're in called inflation and help you get what you need. But just by caring enough to try to find the solution, that's half the battle right there.
Right.
It's I see you, I hear you, I feel you. That goes a long way.
Right.
And that's what we're going to do differently.
Right.
And it's not just going to be a primary adult and pediatric care. It's also going to be mental and behavioral health, because that's a major component that is on the radar right now. We need to keep it on the radar because there's so many people, young people, teenagers, adolescents, that need that help. And, mental health has always been a stigma that to sweep under the carpet, not to talk about, not to recognize. And we need to put it out there. We need to say, we can address those issues. We're here to listen. We're here to help you get where you need to be to get to that point of wellness.
So my favorite words are ecosystem.
Right.
So you are now creating a barrier. You're conquering all the barriers, stopping all the barriers, and now you're creating an ecosystem that go from mental health to wellness.
Right.
Wow.
Wellness with specialty care.
Wow,
In terms of, whether we want to point you to a dentist, whether we point you to Dr. Coker for allergy and ENT, whether we find a pulmonologist for you, whether we find a GI doctor for you. It's really about providing those resources, partnering with our communities, partnering with the resources in our communities who can help us eliminate those barriers. Partnering with DSAM for mental and behavioral health, partnering with DPH to provide whatever resources they may have regarding better cardiovascular health, treatment for diabetes, treatment for hypertension.
Right.
And also to be able to embrace and train the next generation of healthcare providers.
And that's what I wanted to touch on next is, okay, ladies, it's been you and your crew. I would definitely want to mention your crew because you ladies, and do you have any men in your crew? I only know
Every
one male
now
doctor.
and then they
Neil, that's all we know. That's all we know, one male doctor.
They are busy, but we do have a lot of men that do a lot of great work here. Some of them are contractually obligated, but they are there for us just as
and many of the NMA physicians, but First State, we have a First State NMA chapter here, and they're behind us. And we'll be calling on all of them, men and female
Yep.
as far as physicians to really roll up their sleeve and come in and provide those wraparound services.
I had to ask. Because every time I see
You're like,
y'all,
where are they?
right, y'all together, it's like
Yeah.
it's a big convention of healthcare superstars.
Well, let us not forget to mention Dr. Sydney Teal.
Yes.
She is
Exactly.
primary boarded in internal medicine and family practice also, and she will be leading us through as far as primary care. She recently, she had been in medicine over 19 years in Elton Hospital and came to Christiana Care, left Christiana Care in 2021, and so she will be part of our
yes.
Delaware Health Equity Coalition as well as the support from the first state physicians in the area.
Nice. Who else founded the coalition?
We have one more partner in crime. Her name is Felicia Stallings.
Okay.
And the beauty of Felicia is she's an engineer.
Okay.
And so it's a lot of by the book. But the other aspect or the other benefit of Felicia is she had her own business
Right.
in and out of this country
Right.
for years, consulting with different business organizations to help them be more efficient.
Understood.
And then she came back and she became an audiologist.
Oh, wow.
And so she understands healthcare, she understands engineering, she understands business, and she has been an amazing partner with us. So it's the four of us driving this force. We've all been together throughout this pandemic, and everything just sort of came together at the same time. And what I realized on my way over here was, and Velma can probably speak to this, she's recently retired. Dr. Teal recently left a position in December, but because I'm still practicing and practiced throughout the pandemic, folks will ask me about primary care.
Right.
But you're not going to ask a primary care physician about primary care docs, right?
Right.
You can't do that because that'll be offensive.
Right.
So I'm the one that gets, and it doesn't matter they're black, white, purple, green, they're saying, listen, I need someone who's going to listen.
Right.
So while we are physicians of color, we hope to expand to all aspects, and we certainly will treat all patients
Right.
because I have a ton of patients that are looking for a primary care person. So
Right.
it's not just us that feels neglected.
Right.
It is
Absolutely.
many, but some folks are just trying to keep the lights on and build the wealth.
Thank you for saying
But
that.
you can't
Right.
just do that
Right.
because
Right.
now everybody's trying to prepare for the next pandemic. The
Right.
climate's warm. It could happen again. It took the world out.
Yes, it did.
So I
Yes, it
got to
did.
stay ready so I don't have to get ready.
Yeah.
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 And I'm glad
where
that
we
you
are.
said that. It's not just a black or white thing.
No.
And I'm right, because people
Right.
see equity and they immediately go
Sure.
to playing the black card, right?
Nope.
It's blacks for the black and brown people. No, it's for everyone.
It's for everyone.
It's for everyone that feels that just want to be heard. It's
Correct.
and that goes to your tagline, restoring trust in healthcare. I see what you're doing there.
That's what we're doing.
Absolutely.
Okay.
One
Yeah.
patient at a time.
One patient at a time.
Yeah.
Okay, let's talk about this weekend. What's happening on Saturday?
On Saturday, we're going to have the Get Your Shot campaign because it's important as we enter this season, cold season, get your flu shot, but most importantly, getting your COVID vaccine, your bivalent vaccine. We've been hearing people say, I got vaccinated, I'm complete. No, that initial series was a monovalent vaccine. And so the boosters in that isn't necessarily protecting you with for the Omicron and the variant BA4 and BA5. So the bivalent vaccine is what we need to get into our community because that offers the protection. We have to change it. You have to be updated. So you're updated just as you will be updated with your flu vaccine, where you don't take last year's vaccine and assume that you're going to be protected this year. You have to get the new bivalent vaccine to be protected. And as we get into the indoor season and the cold season, we may see a tremendous surge in COVID.
Oh.
And so it becomes important to get protected. People are still dying every day.
Yeah.
We want to forget that, but there's still people dying
Still
from
people
COVID.
dying every- and correct me if I'm wrong. I'm starting to see a lot of people that caught COVID starting to have implications now.
Yes.
Of somehow, and not, it's not just the the loss of taste.
But
it's
long COVID, the fatigue.
Yeah.
There's so many people who have not returned to their baseline, whether it's just chronic fatigue, whether it's mental fatigue.
Yes.
Some people are unable to function mentally because of the changes that the brain has undergone.
So it is a thing. I just want
It
to
is
make
a
sure
thing.
that
It
people
is a
understand
thing.
because
It's a real thing.
I'm seeing
Yes.
people that
Cardiovascular disease.
Yes.
Kidney failure.
kidney failure,
Yes.
forgetting the
Yes.
memory.
Yes, the memory
It's a big
issue.
deal.
Yeah.
It's a big deal. I mean, I've got a young mother that I'm seeing that's just tearful because she was an athlete, you know, and in order to take her children to the playground, she's got to take a nap now. So you're talking about someone who was athletic, rower, soccer player, great mom, and now I got to take a nap to play with my kids.
Wow.
I mean, this long hauler syndrome is a real thing.
That's what it's called?
Yes.
Long hauler syndrome.
Yes.
Okay.
And so many have not gotten the capacity back that they had prior to having COVID.
Wow.
And so what we want to do, I think everybody needs to just wrap their mind around, I'm going to need an annual COVID shot.
Absolutely.
Just buy into that. Just like you get the flu shot,
Just buy
you're
into
going to
it,
get
right?
your annual
COVID.
COVID shot. I mean, last year in January, last year about this time, we were still losing nearly 3,000 people across the country a day.
Right.
Then the holiday season came, and January, the house was on fire.
Yes.
Yes.
Folks were getting Omicron. If all you had to do was just say Happy New Year,
Yes,
and you had
January
it.
was the
6
blast.
minutes. 6 minutes in someone's face, and you had it. Especially if you were within 6 feet of that person. So it didn't take long. And even though you made it through, some had to be hospitalized that had been vaccinated and boosted and still barely making it. I know one pastor, he said he was walking through the ER just praying for everybody.
Wow.
He said so many were so sick, and he was so grateful. I had convinced him as much as he traveled to get the vaccine.
I remember you came in here and you was talking about it. You were, Doc, you were on fire. You were like, look, let me tell you something. This thing's vicious.
Sure.
You made sure you let everyone know at DETV, go get that shot. Go
That's
get
a
that
big
shot.
And what's important too is you realize that some people, especially young folks, said, you know, well, I'm young and healthy. I'll
Right.
be okay.
Right.
But what if you take that back home to grandma?
That's right.
Yes.
What to your parents or someone
Right.
who's
Yeah.
elderly or immunocompromised,
Sure.
or even a sibling or some neighbor's kids who may have cancer
Sure.
or leukemia or other illnesses that may take them out.
Yeah.
Yeah.
And so that becomes so very important. It's not just about you.
So,
It's not about you.
And I don't want to get off track, right? Because you got this event going on. But shoot, I own the network. I want to make sure that we get this out to the people
Okay.
because people still think that we're good. COVID's over. Let's still party. Let's still get together.
No,
Let's
it's
still. And you're late. You were saying, no, we're not over. We're not even through the woods yet.
No.
We're nowhere through the woods. Is
No.
is that safe to say?
It's safe to say. It's safe to say. And as she mentioned, these new variants of the Omicron.
Wait a minute. More new variants
Of the variant.
Of
Yes.
the variant.
Variants
Yes.
of the variant. And here's the thing, Ivan. The reason why we keep moving to the next variant is because folks don't have a weapon in the toolbox. So when COVID enters, it can become whatever
So
it
it
wants.
changes. Every time it goes in and out of a person who, it then
What?
it mutates
That's
into a
right.
different form.
That's right.
And the more it hops around,
That's right.
the more mutant forms you have, and the more we have to struggle.
That's right.
Have you ladies ever seen anything like this before?
Not in my
Never.
lifetime.
Or heard anything
Never.
like this before?
Never. But I think it had to happen. It had to happen for so many reasons. And one was to get the attention of these young people because they were Googling everything, TikToking. They didn't care, Ubering it.
Yeah.
You know what I mean? Like, if you can't answer, I'll get it. But it stopped them cold in their tracks and said, okay, so maybe not today. Now they understand, like we understood as kids, not now.
Right.
It's coming, but you got to be patient.
Right.
So they're just different people now, and
Right.
they're better. But while you have everyone's attention, you must maximize that. And that's why we knew we had to get this primary care practice open
Yeah.
right now.
Right.
To
Yeah.
get ready for the next big thing.
I see what you did
Yeah.
there.
So we're
Roger
doing.
that.
So
Okay.
while
what
we're
we're
not
doing.
ready to take care of patients, we want to get folks vaccinated. We want to get them protected.
That's right.
We want them to get this up to date. bivalent vaccine and get their flu shot. And they can get them both at the same time.
Okay, so we're talking about prevention
Yes.
for the next round.
Yes.
Correct.
Right? Starting Saturday.
Saturday.
Is that safe to say?
Yes.
10 to 2.
Okay, where at?
2100
2100
Boulevard.
Baynard Boulevard.
Okay, all
Sweet
right.
Air. They'll have
We're right
flyers
outside.
and balloons and everything else to make sure you know where we are.
Okay.
Can't miss us.
All right. I am speechless right now. And I'm glad we had this conversation. I love talking to you ladies. First, you're just so much of an inspiration to know that you're doing this because not for the money, but for the love.
Oh, for the love.
For the love of humanity.
That's right.
And the love of Mrs. Joan Coker, your mom, Miss Coker.
Mrs. BB Coker.
Right. And you,
BB
Doctor,
Coker.
and your great accomplishments, what you have been doing. Thank you again.
Thank you for having us.
At any time. I like literally any time. Let's hop back over to your Health Equity Coalition.
Okay.
What other services will you provide for the masses?
Our goal really is to, we hope to be able to hire and have community health workers because those are important aspects of really engaging patients,
Okay.
really meeting them on their playing field, identifying what are their struggles, what are their barriers in order to get them to the wellness, to the medical home, and not get them to really see the need to follow through. And I think, data has shown that if patients can have that consistency through medical visits in a medical home that they can identify with, you will eliminate those disparities and barriers because what happens, you develop that trust.
Right.
Yep.
And as trusted messengers, the goal is to be able to be there, as Joan said, to listen, to be there to hear them, and to work with them, work with the community resources to be able to bring our community and our patients up to a level of wellness, whether it's, as we said, seeing the dentist, whether it's seeing the cardiologist, whether it's getting internet services, whether it's needing to come to our office if they need to do a telehealth with their pharmacist so that they can understand the medications, whether it's meeting with the nutritionist so that they understand what diet restrictions are important to better health.
One hub where people can say, hey, Doc, I need help.
That's the goal.
Gotcha.
That's the goal. That's the difference. I think what I love about our team is Dr. Sydney Teal has been on the front end for a number of years as a primary care physician, family practitioner as well. She's boarded in both. Velma was on the back end in the sense that she's a transplant surgeon. So that means when all else failed, you've got to come to me so that I can get a transplant for you so you can continue to live. So she gets the importance of all of it because you didn't want to get to the old Velma in the sense that the transplant surgeon, because now we're at the end of the road. Sometimes not your fault, sometimes family history, genetic makeup, but she could fix that problem. And now she gets it. And like the rest of us, we smile a lot, we joke a lot. Velma's serious because she knows if you don't get it right, you're going to wind up here.
And that's just those with diabetes, those with hypertension.
That's right.
Obesity, smoking,
she gets
cardiovascular
it.
disease.
She gets it.
There's no in between. There's
no in between.
Doc, I'm going to ask you both this, but I'm going to start with you, Doc. Can you tell the viewers like the history that you made?
Where do we start?
What history?
The history. This is the first African-American transplant woman of color in this nation.
In the nation.
Right here in Delaware.
State, not the state.
The state? In the nation. So
and again,
awesome.
Thank you. My question to you is, because I love to use this platform to motivate people and inspire and inform people. Who was your motivation growing up for you to say, and the question's coming to you too, are like, I want to be a doctor?
My mother. My mother was determined, strong, phenomenal woman. She went after what she wanted, and she didn't see the barriers. If she thought she needed something, when she said she was leaving Barbados to come to the United States, and she left us behind because that's what she wanted to do. She wanted to provide a better education for me. She knew I wanted to go to medical school, and she says, I'm gonna make it possible.
Wow.
So she came, and so she has always been. We butt heads a lot because we're determined, strong-willed, but she was a go-getter. That she didn't let things stand in her way. And for me, becoming a doctor was something I wanted to do because I wanted to take care of people.
Right.
I wanted to be my own boss. I wanted to be able to have control. I wanted to be able to fix the world. And so for me, that was my motivator. And, you know, when I saw in my residency, when they told me I couldn't be a surgeon, I wanted to be a surgeon. And I wanted to be a pediatric surgeon because the first female surgeon that I saw was a pediatric surgeon, and I wanted to be just like her. And then I, you know, got exposed to transplant, and transplant was really an avenue for me to become a better pediatric surgeon by doing the research. And that was a whole world opened up to me once I entered transplantation.
Wow.
That's cool.
Yeah.
And it is beyond.
What's beyond is the surgery itself. To see a transplanted organ is just an amazing thing. It's amazing.
Yes,
it's amazing.
Yeah.
And before we come to you,
Yes.
let's talk about the barriers that you had to jump through, fight through, because again, there's someone young that's saying, "Hey, look, I want to be like her," you know, but I'm having a problem right now. Can you just talk about some of the barriers?
Unfortunately, we have a MOCA transplant women's group that, even though I finished over 30 years ago, are still facing the same issues.
Yes.
Yep.
Yeah.
The same issues of not being seen, not being given the credit, being discouraged, and so many times along my way being told you don't fit the mold. You know, you don't have what it takes to be a surgeon. You don't have what it takes to be a transplant surgeon, just in general.
And they told you
and
that.
Yeah. And so you are viewed not because of your ability, but just because you walk in the room and you look different. And that is still existing. And so many of our young people need to understand that you have to stand out. If you are determined that this is what you want to do, and you're struggling, find someone to guide you. Find that mentor, find that sponsors, find that person who is going to tell you that to believe in yourself, believe that you can do it, and build that self-esteem, because without that belief, you will walk away, because you then take those negative perceptions that someone said, you know, maybe that's true.
Right.
Microaggressions.
You need those positive reinforcements.
That's right.
And that's what my mother did. When others came home and said, you can't, she's like, you're not college material. She's like, hell no, you're going to college.
Right.
You know, because you have to dismiss all those naysayers. And and for young people today who may not have a family, or, you know, parents may be working, it may be your grandmother, it may be your aunt, it may be your teacher.
Right.
It may be someone at church, it may be your neighbor. And so we can play a role in the lives of our young people by being there for them, hearing them, encouraging them, and providing opportunities for them.
Right.
Yeah.
Thank you.
That's where we are.
How about you, Dr. Coker?
Well, my grandfather died preaching and was buried on my 16th birthday, right at Union Baptist. Started the sermon, massive heart attack right there in the pulpit, and was gone. And for me, it was a game changer, you know, because you feel so helpless. But the motivating factor of that moment was with COVID. Because what I realized as I sat in the parking lot getting ready to enter the ER, which I knew I could go in and come out and be gone in a few days.
Right.
But if I were to die doing what I love to do, just like my grandfather, it's A-okay.
Right.
It's A-okay. But certainly you're wiser, you're stronger, you're better. So if there is a weapon, use the weapon.
Right.
Use the weapon. Yeah, we're going to all say our prayers.
Right.
God is so good. But he grants us wisdom.
Right.
Right?
Right.
So you take that wisdom and you do the research, which we all got on so many calls just to make sure that we were messengers of truth, because we knew what it meant in the Black community.
Yes.
And so to the blackdoctors.org that had those Making It Plain sessions, and oftentimes Kismakia Corbett joined us, thank you.
Right.
Because they helped guide us, reassure us, restore our faith that this was okay for our population, and we could sell this and take this and be okay.
Love it.
That's what it's all about.
That's what it's all about. All right, we look, ladies, thank you so much. Anytime. I'm gonna give you the key to the building. Anytime y'all want to come, we'll just turn the
We're gonna hold
cameras
you to
on.
it.
All
We're
right,
gonna hold you to it.
you can do whatever you want here, and please come back again. Let us know what's going on, how we can
Sure.
spread the good news. The Delaware Health Equity Coalition event is this Saturday.
That's right.
Can we give them the time and place again?
10 a.m. to 2 p.m. And it will be at 2100 Baynard Boulevard.
Okay.
Got it.
Right on 21st Street and Baynard Boulevard.
Okay.
Yes.
There you go. You have it here. Be sure I'll see you there Saturday because I'm going to get my shot. That cool?
That's great.
I'm going to get my shot, and I'll probably record from there. But look, I'll see you on the other side. For any information, any questions, where can they go?
To Delaware Health Equity Coalition.org. That's it. Yeah.
That's it. There you go. All right, we're getting out here to give me hand signs. All right, I'll see you on the other side. Good morning, Wilmington.